Hello, I'm Ann Stevens from Seattle Children's Hospital and the University of Washington. I'm here at the RWCS meeting in Maui. And I have just recently given a lecture on neutrophils in autoimmunity. In the last couple of years, there have been some really interesting advances studying the effects of neutrophil netosis and how this may promote chronic inflammation in the autoimmune diseases that we treat in rheumatology clinics. Netosis is the process of neutrophil death in which DNA from the nucleus is extruded outside of the cell, and the DNA is associated with all of these granular proteins, and these proteins we know very well as autoantigens in our diseases such as MPO, PR3, and neutrophil elastase and histones. The neutrophils are starting to come to the surface as a major mechanism of pathogenesis of most of our diseases. So then the question is, what determines whether a patient gets rheumatoid arthritis versus lupus versus vasculitis? We know that neutrophils and netting, this extrusion of DNA with pro-inflammatory autoantigens, happens in all of these cases. And what we know is that the associated proteins in a netting neutrophil from a patient with rheumatoid arthritis, those proteins are different. Those are citrullonated histones, those are citrullonated enolase or vimentin proteins. In lupus, different autoantigens are present, and in vasculitis, different autoantigens. So the presence of these granular proteins are different. What we also know is that we can connect the interferon signature that we know is so important in lupus to neutrophil netting. And that's because the nets are not only our nuclear DNA, but they're composed of mitochondrial DNA. And the mitochondrial DNA has been oxidized by the reactive oxygen species that are produced in an activated neutrophil. This is part of what a neutrophil does. It kills off bacteria by these ROS compounds. And it also oxidizes the mitochondrial DNA. If you take mitochondrial DNA that's been oxidized, add it to a dendritic cell, that dendritic cell is activated to make type 1 interferons, just like in lupus. So this connects findings that were published in 2003 showing that there's a major signature, an mRNA signature in patients with lupus that signifies granulopoiesis, and a signature that signifies interferon-induced gene expression. So it connects these granulocytes to the interferon signature. Knowing more about this pathway of netosis leading to chronic inflammation, leading to breaking of tolerance in autoantibodies to proteins that are in the nets, suggests multiple steps along this pathway at which we can intervene with medications. And the future of this area is focused on drugs that may block netosis, that may block the reactive oxygen species production, that may block the citrullination of peptides that allows this netosis process to occur. So we're going to look for these medications coming out in trials in the next few years. Thank you and aloha.